let me show you some different things that you need to make sure that you're documenting that will help us all get to the bag. Um, Again, speak their language. So really, instead of saying there's insufficient documentation, like I said earlier, you can document yourself out of a bag. Don't say all those things. You can think them, but don't say that to them. Just say, something like, um, let's make sure we're capturing everything that you do. Let's make sure that we can read this documentation and understand exactly what happened in that OR. Um, Also, be proactive. Um, when the scheduling is done, you can kind of look and see, okay, he has this complex surgery coming up this week or next week, and we know these may be a challenge. So, hey, let's make sure we're having a conversation maybe before those surgeries. Don't forget, these are some problem areas that we're having. So just make sure, you're documenting everything. If something goes left, make sure you document all of the things that may go left, all of those things. And then sometimes um, you have some providers who like to see things on paper. I know I had developed this was when E&M was E&Ming, and I had developed pocket pals for my providers. And so, they always had stuff in their pockets. Again, well, they still have stuff in their pockets, but I was supposed to say this is pre EMR, but they were still carrying them around. So I created all these laminated cards that had each E&M code on it, and then it gave you what was required for each of the levels. So it was a quick, easy way for them to be like, okay, I think this is level 4, da 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 da. And we've also provided education on that. So this was just a follow up to the education. So maybe there's like some quick reference information that you can provide them, on complex cases that they may be using to as reminders. Don't forget that you need to do this. They need to be reminded too sometimes. And again, it's fast paced, it's busy. Um, just some tools in order to assist them. So, when a provider kind of sees you as a partner rather than just another person that's giving them the blues and giving them the business, that's when the magic happens. That's when, you're building a relationship, because then they know, oh, they helped me through XYZ. Another, they can be proactive and say, hey, I'm thinking about doing this, or I'm thinking about this. Let me go to you first to see if I can get some assistance beforehand, versus being, reactive, like, okay, all of these got denied. Now what? No, they already know they're going to do something. They're going to switch something up on you. So maybe they can feel comfortable coming to you and talking to you about what it is that they may switch up. Again, that's building relationships. So, understanding your customer. Some of the customers that we have again the provider as a customer, and there was just some information related to that. Mr. Jesse, did you want to add in? Have any thoughts?